I often get to hear that vitamin D deficiency is so common, and people kind of say it in a way that it's not really something we need to care about. And I even see doctors say the same, well, vitamin D deficiency is so common, so there's really no need for any action. But it's actually the opposite. It's just like saying just because poverty is very common in a lot of countries, or lack of education is very common, that is not a reason not to address it. And vitamin D deficiency is very common. I'm right now in Norway, and the daytime you have maybe 8 hours, 7 to 8 hours of sunlight here where I'm right now, and in northern part of Norway you might have sunlight for maybe 4, 5, 6 hours, so certainly not enough. But even if you're in the countries with warmer weather, longer days, and you get more, there's more sunlight, if you're not spending time out in the sunlight, it doesn't do you any good. You are not going to make more vitamin D if you're staying inside your house or confined in your office. Now, in many countries, including the Indian subcontinent, it's very common to want to be as fair-skinned as possible. And people actively avoid sunlight exposure, which also means that although there is a lot of sunlight and the days may even be longer during the winters, we still do not have a lot of people are vitamin D deficient. And vitamin D deficiency can lead to a whole range of issues, including you can have depression, anxiety, you can gain weight, the risk of type 2 diabetes increases, the risk of hypertension increases, and you might have a higher risk of autoimmune diseases. So there are a whole range of reasons why you would want to keep your vitamin D level in range. And what is the range? Well, the normal range is usually said to be 30 to 100 nanograms per milliliter, but that is certainly not enough. We know from studies that you should be higher. The more optimal range is 60 to 80 nanograms per milliliter. And some patients, especially if they have autoimmune diseases, or maybe they have vitamin D receptor resistance or issues with their vitamin D receptor, in that case, I would want the patients to maybe be well beyond 100 nanograms per milliliter. Regardless, I do suggest that you speak to your functional medicine doctor, try to identify whether or not you have vitamin D deficiency and what your optimal level should be, and how much you need to supplement with vitamin D to get within that range. It is very, very important, and it's certainly not something you would want to ignore. I strongly suggest you do follow up with your functional medicine doctor to have the treatment and bring the vitamin D in range, in the optimal range, 60 to 80 nanograms, or maybe even higher than that. Anyhow, thank you for watching the video. I'll see you in the next video. Thank you.